Hello. Welcome to the session on an overview of federal disability categories for identified students. Here is the session description. Feel free to pause the recording so you can read over it. My name is Valerie Chapman Jones. I'm a staff developer at Lincoln Intermediate Unit 12. You can look at my identity map to learn a little bit about me. I am a trainer consultant or a TAC in student services under the following pillars: low incidence, LEEI, and community partnerships. My contact information is there if you wish to reach out to me after this training. We have one outcome for today's session. Participants will classify the categories from federal law for students with disabilities. This is the federal definition of a child with a disability. I will give you a second to read it over. Please pause the recording so you may read over the definition. If you notice on the right, there's a gray box that says Deeper Dive with a resource linked into it. Throughout the presentation, you will see some deeper dives, and what those have are resources, websites, articles, information that can help you learn a little bit more about that particular area if that is something you're interested in. Now, I know that paraprofessionals typically do not see students' IEPs. They recognize that all students they support have a disability and they all have an IEP or individualized education plan. I just wanted to let you know that in the student's documentation, there is somewhere you can see what their disability category or categories are. And the two places are the evaluation report. That is in the initial evaluation for special education services. So if it's a newly identified student, it would be under this little box you can see here with the C and the checkbox. This is a screenshot from a template. It says the student has a disability and is in need of specifically designed instruction and therefore is eligible for special education. And then you'll see a 1 disability category, primary disability category with a colon. So the overall main disability category will be listed there. Then underneath it, it says secondary disability category. You may have students who have a secondary disability. For example, specific learning disability could be the primary. Speech and language impairment is one that is often listed as a secondary. There are students who may even have a tertiary or third disability category listed. The student's disability category or categories is also listed in the reevaluation report, which will occur every 2 or 3 years, depending on the student's disability category. And you will see that little box next to the A being checked, and it says the student has a disability and continues to need specially designed instruction. And once again, it lists the disability category, and the primary disability category will be filled in, and any secondary or additional categories will also be listed there. One place you will not see a student's disability category is on their IEP. It is not listed there, which is why I just wanted to point out it is on the evaluation and reevaluation report. Qualifying for special education. How do our students get these disability categories? Here in Pennsylvania, we have a two-pronged approach. Both of these criteria must be met for a student to be considered a child with a disability. 1, they must be found to meet the qualifications to be classified under one or more of the IDEA disability categories. And I'm going to go over what each of these are during this presentation. But then there's a second component. The identified disability, whatever that category may be, has to adversely affect the student's educational performance, requiring them to need specially designed instruction. So they may meet the criteria of having a disability category, but if it doesn't affect their educational performance and they don't need specially designed instruction, they are not eligible for special education services. And once again, you can see there's a deeper dive there with a teacher's desk reference from Patton with a special education overview that will give you more information on that topic. There are 13 disability categories that are recognized by the U.S. Department of Education, and we are going to talk about each of them. Please take a second to pause your recording and just read over the listing. In this presentation, we're going to group hearing impairment and deafness together when we talk about them, even though they are two separate categories. Now, these disability categories can fall under what we consider high incidence or low incidence disabilities. High incidence disabilities, those are what it says. They occur more frequently in the school age population. So these are going to be the students maybe you as a paraprofessional are seeing more frequently. Low incidence disabilities, by definition, means less frequent, of course. And the statistic they give is less than 20% of all students with disabilities. So that's the kind of number. If it's greater than 20%, it would be considered a high incidence. If it's less than 20%, it's a low incidence. So examples of low incidence, and we'll talk about this more, but those are typically our students with more significant cognitive disabilities and just other complex needs. And a lot of times our low incidence students require that specialized intensive service. And many of these students will have paraprofessional support. So you may already be supporting low incidence students. So I pulled up the 2024-25 Pennsylvania disability enrollment data. So this is for the entire state. And you can take a look there at the total enrollment of special education students compared to the overall enrollment. Again, about 20% of our students overall are in special education. And then you can look at the disability categories that are listed there. And again, as I said earlier, they kind of include hearing impairment, including deafness, even though those are two different categories. And you can look at the percentages and look in your head, which one of these are high incidence disabilities? Which one of these are low incidence disabilities? Let's start with specific learning disability, which is a high incidence. You can look here and see 36.7% of our students with disabilities are diagnosed with this type of disability. So, as a paraprofessional, you very likely may be supporting students who have specific learning disabilities. For each of the disability categories, I provide the federal definition of it, and I will give you a second to read over it. So please pause your recording to read over the definition of specific learning disability. One thing that is important to note, you may hear terms like dyslexia thrown out, dysgraphia, dyscalculia. These are not separate disability categories. Rather, they fall under specific learning disabilities, which is an umbrella term. Specific learning disability is a little bit different than some of our other disability categories because it's a rule out. The school psychologist who's doing the assessment has to make sure these conditions are ruled out before determining if a student has a learning disability. So these are the reasons that a learning disability might be ruled out for a student. It can't be due to lack of appropriate instruction. It cannot be due to visual, hearing, or orthopedic disability, and we will talk about those a little bit later. It cannot be due to an emotional disturbance, which we'll also discuss later, an intellectual disability, which will also be covered in this presentation. It cannot be due to cultural factors. It cannot be due to environmental or economic disadvantage causing the learning difference. And finally, the learning difference cannot be due to limited English proficiency. So Again, a school psychologist who's evaluating a child needs to rule out all of these before they can say, yes, this student demonstrates a specific learning disability. Here is a description of specific learning disability, and we're going to follow a pattern throughout this presentation. You're going to have the definition of the disability category and then a description so you can learn a little bit more about it. Now, you can have a specific learning disability in a lot of different areas, and students may just have it in one of these areas, but for many students, they have a specific learning disability in multiple areas. So it can include oral expression, listening comprehension, written expression, basic reading, reading fluency, reading comprehension, mathematics calculation, and or mathematics problem solving. And please note there is a deeper dive on this slide. The next disability category is speech or language impairment. Please pause the recording and take a second to read over that federal definition. And the description of what is a speech language impairment. The person in your school who would provide services for students who need special design instruction in this area is a speech language pathologist. You may commonly hear terms like speech therapist or speech teacher, but a speech language pathologist is the professional who provides these services. Speech language pathologists provide a diverse type of services. Not every student who qualifies for speech language impairment has the same profile. This includes speech sound production. So, for example, students who have say a lot of incorrect sounds, like they may say W's for L's, they may say D's for TH's, they may be difficult to understand. It may be related to the understanding of, so comprehension or use, the verbal expression piece of spoken language. That can include use of grammar when speaking, use of vocabulary. They might have word finding difficulties and vocabulary errors. And it could also include pragmatic or that social language, which we see that a lot in our students who have the disability category of autism. Speech fluency is another area of services. That means stuttering. So when they might repeat sounds too many times, like this, or hold out sounds too long, like sometimes. Another area that you might not be as familiar with that speech language pathologists provide services in is voice differences. And they have to be differences in pitch, loudness, or quality. In order for a student to qualify for services under a voice disorder, they must have a medical clearance from an ears, nose, and throat professional before they're eligible to receive any school-based services, because they need to rule out that there isn't a medical cause that needs to be treated before services can help that student. And there's some deeper dive resources on the slide for you to learn more about speech and language impairments. The next category is autism. It has a little bit longer of a definition. Please pause the recording and take a second to read over it. Autism, a description. Autism is one of these sort of unique categories that it could be considered a high incidence disability. We know the incidence of autism is definitely increasing in our schools, but it could be considered low incidence depending on the students. So we're thinking our high incidence students with autism, they may be verbal speakers. They are in general education for many of their classes. They might just get extra help from like an itinerant learning support style classroom. They are typically included with their regular education peers for most instruction. But it can also be low incidence. If we think of our early learners, our students with more significant needs, they may be seen in a self-contained autism support classroom and have more significant needs. And so autism is one of those tricky ones that it's really common, so it can be high incidence, but it sort of depends on the profile of the students if they fit more of a high incidence profile or a low incidence profile. And that relates to our next point, is that autism occurs on a spectrum. And you've probably heard that many times before. But some of the key characteristics and this was in the definition, social communicative differences. So we talked about speech language impairment. That pragmatic language is one of the areas covered. That's why many students with the autism diagnosis receive speech language services to work on those social language skills. They may have restrictive and or repetitive behavior, and that can certainly look very, very different from student to student. And they have sensory differences. Again, it's very variable from student to student what that's going to look like. Some students may be sensory seeking, some students may be sensory aversive. And there are two links there if you'd like a deeper dive to learn more about autism. The next category is intellectual disabilities. Please pause the recording to take a second to read over that definition. A description of intellectual disability. You must meet two criteria to qualify under this category as a student. First is below average intellectual ability, meaning an IQ score of below 70 or cognitive impairment. So, for an evaluation for intellectual disability, the school psychologist will be administering an IQ assessment. And if the score is below 70, they could have an intellectual disability. But they need to meet that second criteria. It is not just about cognitive impairment. They must have significant limitations in adaptive behavior, which can include conceptual, social, practical skills. These could be things like self-help skills, such as feeding or dressing, interaction skills, academic skills, any of those self-care type skills and being able to problem solve and adapt in their environment can fall under that. The adaptive behavior, there's the school psychologist will give rating scales to evaluators to determine where that student's adaptive behavior is, where they fall. Can they do this independently? Do they need assistance to do all of these skills? The next category is emotional disturbance. It is quite a lengthy definition. Please take time to pause your recording so you may read over the definition of emotional disturbance. A description of emotional disturbance. It includes two characteristics, both academic ones and behavioral ones. In the academic realm, you would often see failure or severe deficiencies in the areas of attention. So they're doing poorly in academic subjects and they have significant attention issues, and they may demonstrate lack of motivation. Behaviorally, it can look very different from student to student, just like all of our disability categories. But commonly, things you might see, mood swings. They may appear depressed. They may often have inappropriate responses to different situations that occur at school. Impaired interpersonal relationships that can be adult to student or student to student. And these students also have a very low self-concept about how they feel about themselves. The next category is multiple disabilities. Please pause your recording and read over the definition. Multiple disabilities means exactly what it says, more than one disability. And because of that, no two students who have this label are going to be the same. This can impact the students with multiple disabilities can impact a lot of times your self-care skills. So thinking of those adapted skills I mentioned earlier in children with intellectual disabilities, those are going to likely be an issue. Their fine motor and gross motor skills, so they may have significant difficulties using their hands. They may also have difficulty with ambulation. They may or may not be in a wheelchair. They may have vision deficits, or hearing deficits, or they may also often have communication skill deficits. So thinking speech and language impairments. Students with multiple disabilities may have difficulties with eating. So you might see students who are tube fed, for example, sleeping. So again, their sleep and wake cycles might be a little bit different, and these might be students you see sleeping during part of the school day. Or they may have breathing issues. You may see students who have a tracheotomy and have to be suctioned, for example, by a nurse. And having multiple disabilities often is going to affect their learning. Traumatic brain injury. Please pause your recording and read over the definition. Traumatic brain injury description. Traumatic brain injury can result from a lot of different things. For example, car accidents, falls that they may have where they hit their head. Sports injuries are becoming more and more common with traumatic brain injury, physical abuse, and any myriad of ways where a student may have hit their brain and caused some kind of injury. These students have a very diverse profile because they may have some recovery initially and some deficits may not appear till several months later after the injury. So we do need to keep a very close eye on any students who experience some kind of brain injury to determine are they going to be eligible as a child in need of special education under this disability category. And there's a very diverse amount of characteristics. Sometimes they'll have physical injuries, they may have cognitive differences, and you often will see some emotional impairments. And these are three characteristics that are pretty common. Difficulties with memory, difficulties with comprehension. They may have a lack of energy. They may be very tired, and they may also be confused and distracted. And these are students who, prior to the injury, may not have had any learning difficulties or any disabilities. So this can be very confusing for them because things that used to be easy for them are now difficult for them. Feel free to do a deeper dive to learn more about traumatic brain injury. The next category is hearing impairment, including deafness. So those are kind of grouped together. Please pause the recording and read over those definitions. The description of this disability category. It does not include auditory processing disorders. Students with that diagnosis would fall under other health impaired or possibly one of the other disability categories I already discussed. The severity and needs can change dramatically. We can have a slight hearing loss, all the way up to profound hearing loss. And depending on the child, they may have a progressive loss where they might start out with slight hearing losses, but as they age, they may have more hearing loss over time. Oftentimes, hearing impairments certainly result in communication difficulties, and they may often have a secondary diagnosis of a speech language impairment. These students require assistive technology tools to be successful in the school setting. Examples would be a wearable system where the teacher talks and the students can hear directly into their aids. They often wear hearing aids, and they often may need closed captioning, for example. These students may use American Sign Language as their primary mode of communication, and they may also need an educational interpreter in the classroom setting who is using ASL with them. Please feel free to do a deeper dive to learn more about hearing impairment. The next category is visual impairment, including blindness. Please pause your recording and read over the definition. A description of a visual impairment, including blindness. Their visual skills may vary day to day and depend on the environment. So if it's a classroom that's really bright, or a classroom that's really dark, or classrooms with different lighting situations, that can make it more difficult for the student. They often need assistive technology supports. And definitely, many of these students need reading supports. For example, they may need they may be reading in Braille. They may also need larger print or high contrast colors so they are able to see the academic material. They need assistance with accessing any visual information. So that's something we need to think about when supporting these students. Whiteboards could be a problem because there's often a glare. Videos can be an issue. We might need audio description on those videos so that they can know what is going on since they can't see them. They also may need support in navigating environments safely. Feel free to look over those resources to the side for a deeper dive on visual impairments, including blindness. Another category is deaf blindness. Please pause your recording to read over the definition. As with all the disability categories, I feel like I've said this a few times, there's a wide range of characteristics for deaf blindness. They may or may not have usable hearing and vision. So deaf blindness doesn't mean they can't see anything or they can't hear anything, but rather they may just have impairments in both of those areas. And due to that limited sensory input they get from their eyes and ears, these students often have really limited life experiences, and how they explore their environment is going to look different than typical students. So a lot of times they're trying to gather and seek information from their environment any way they can. For example, using their hands and using body movement to gain information. And sometimes they might be incorrectly interpreted as, oh, they're engaging in behaviors when they're actually just trying to get information from their environment using what's available to them. Students who are deaf-blind definitely need multimodal instruction, and they need numerous supports from staff, and they also need a variety of assistive technology skills to be they also need a variety of assistive technology tools to be successful in the classroom. Feel free to read those resources at the side for a deeper dive. Orthopedic impairment. Please pause the recording and take a second to read over the definition of an orthopedic impairment. There are many different causes of orthopedic impairments. Some students could be born that way. And the severities can range. It could be a limb difference, for example, whether they were born with a limb difference or there was an accident that resulted in a limb difference. These students are likely going to have physical therapy and occupational therapy support services. And some of the areas they might need some assistance with, and you as a paraprofessional may be providing some of these, is navigating around the classroom and the school, transportation. They may have chronic health conditions related to their orthopedic impairment, and just their physical stamina throughout the day could be an area of concern. Other health impairment. Please pause the recording and review the definition. Other health impairment description is very broad, very varied in nature and severity. They likely have medical issues and may need school health services from a nurse, and they may have some issues with school attendance because of their medical issues that are the reason they're an other health impairment diagnosis. It's really hard to talk about individual characteristics and what their needs are going to be because it's going to depend on so many issues. And three examples that are impacted could be physical strength, endurance, and alertness, but it just will depend on what the reason they qualified as a student with another health impairment. One of the most common areas you'll see this are students who are diagnosed as ADHD or ADD. They often will qualify for special education under this category. You may have heard the term developmental delay used, especially for transition students from preschool to school age, or if you work in preschool. However, that is not a school age disability category. It is only used for the preschool setting, which is why we're not discussing it in the context of this presentation. These are the citations and some generative questions. So you may want to consider these or use these as talking points. How might knowing a student's disability category influence yours or others' expectations of the student? Why might students with the same disability category need different supports? Thank you so much for attending this presentation.